program. The homestead is well run, and part of that is due to the administrator, Deidre Navarro. Deidre, you've been here, I understand, 3 years?
5 years.
5 years?
Yes, ma'am.
Seems like 3, doesn't it?
Yes, ma'am.
One of your main duties, I imagine, is dealing with the families when they first come in and asking for information, and after they have placed a relative at the homestead. How difficult, and what are your steps?
Well, I don't know that it's really difficult because, of course, forming that initial relationship is extremely important, and that happens when they walk in the door. From the very first phone call to the very first visit, you start to form that relationship and have that good rapport that will carry you through from if they do admit, even if they don't. They can call on you, you offer your assistance in any way you can.
Is it easier to deal with the family of a dementia patient or resident than with someone in independent living who thinks, I'm not ready for this yet, and yet time and age are catching up with them?
I would have to say sometimes that's true, but oftentimes it's not, because dementia, unfortunately, as sad a disease as it is, that's a very hard thing for families to accept and understand.
So are you having to, do they come with, I can't wait to see, or I don't want this at all? Do you see that kind of reaction?
The main reaction that I see is, this isn't really something that we want to do, but we know we have to do something. And I think that the most important things to families for their residents is to make sure that the choice that they make is going to be the best fit for their loved one.
And I don't envy you having to deal with this situation, but you don't look like you've been here 5 years.
Well, thank you.
So you handle it well.
I try.
So when you're ready to come out to Homestead, either for information or for a more serious chat, don't hesitate to call either Deidre or Ann Brown. But Deidre is your main contact as the administrator. One of the most important aspects of the Homestead Village is the care that the nurses give. And we are in Building I, where there is a nurses station. We have here the Director of Nursing, Janice Bonner, and from hospice, because we've talked about hospice a little earlier in the show, Jan Fillmore, who is one of the nurse practitioners. Janice, your job, you have a mammoth job as Director of Nursing. How important, how complicated, how complex is it for you and your staff of nurses?
Well, the nurses are responsible for all the daily activities of the supervising the PCAs.
What is a PCA?
They're personal care attendants, and they're the ones that are one-on-one with the residents. And then we have the nurses that work with the doctors on medication management. They work with hospice very closely.
So do y'all monitor patients or clients or residents' medication? You make sure they take it? Tell me about that.
Well, the nurses are responsible for supervising the medication technicians.
How many nurses do you have here at Homestead?
We have 10.
10 nurses?
Full staff of nurses.
Is it hard to find a staff of nurses? Because they keep saying there's a shortage of nurses.
Well, we've had a real stable staff. I've been here 8 years and have some other nurses that are 5+. So.
Does a nurse, you say you've been here 8 years, does a nurse have a tendency to get burnt out in an environment such as this at the Homestead?
Well, I've been lucky to start off as a med tech and move my way up, so it's been
okay.
Yep.
All right, Jan, we mentioned hospice. You're a nurse practitioner with hospice, and you have some residents who are under hospice care here at Homestead?
Yes, we usually keep a census. Covenant Hospice keeps a census here of 22 to 25 patients.
That many?
Yes, because with hospice care included in the assisted living care, it can help actually extend people's opportunities to remain in assisted living.
Is there a time limit to hospice?
There is not a time limit to hospice. We take care of patients that have life-limiting diseases, and we're in to help and support their families for whatever time they have. And we hope that we make a big difference in the quality of care in both their lives and their families.
All right, and I'm sure everyone out there, or some people out there, are saying, hospice, what about insurance? Is it covered?
It's covered by Medicare, and it also, they cover many drugs that are disease-related hospice diagnoses, as well as durable medical equipment. We have social workers, we have nurses, and also we can add to the staff at Homestead by providing some caregivers also that come out 3 times a week to support some of the caregiving that goes on, personal caregiving.
Things have changed in the medicine field in the 8 years in which you've been here.